Good morning, everyone. My name is Cynthia Laughlin. I'm a pediatric emergency room nurse at Levine Children's Hospital in Charlotte, North Carolina. I've been a pediatric emergency room nurse for about a year and a half. I've been a pediatric nurse for about 6 years. I have a degree from Purdue University, both in nursing and in organizational leadership and supervision. Nursing is my second career. I did work in technology for many years prior to nursing, but getting caption on this video might be difficult, so we'll see how that goes. A little bit of background information. I grew up in Indiana. I've been married for 17 years this year. My husband and I have one 14-year-old son who is active in soccer and running, band. He loves to read. We got pretty lucky in the kid department. We also have two amazing 5-year-old Labradoodles who are full of energy and who may be running around this house. So if you hear barking, I apologize. The project that I want to work on is actually one of our compromised populations within pediatrics. It is working with our sickle cell kids. And when those kids come into the ED, making sure they get back to a room as quickly as possible. What I'm specifically focusing on are sickle cell patients with fever versus sickle cell patients with pain. And the reason I'm doing that is we are lacking in getting those kids back quickly. We're finding that there are barriers to getting them antibiotics within 60 minutes. Some of those barriers are if our ED is very busy, we may not be able to get them back as quickly as we'd like. Also, our ED is currently under construction, so we are down a couple rooms as well, which makes that even a little bit more difficult. Another barrier is when they come in, is registration, being able to identify those patients and how we can help registration and those patients identify themselves so that we know that there is a sickle cell patient sitting in our waiting room. One of the biggest things is we're missing our mark on getting those children antibiotics within 60 minutes. So that's it's very important to get them their antibiotics within that 60 minutes, just so we can help prevent a crisis. We can help prevent acute chest syndrome. And a couple of the barriers to those is maybe not getting IV access. And with that, we're supposed to be giving IM injections of Rocephin if we don't have IV access within 30 minutes, and why that isn't being done. So my focus is on sickle cell patients with fever, getting those children the antibiotics very quickly, getting them seen very quickly. Thank you for taking the time to listen to my introduction video. I hope everybody has a great day. Thank you.